And now we come to my favourite part of this short lecture series, which is how to optimise exercise to contribute to better metabolic health. So in the induction phase of a low carb, low insulin lifestyle, intensive formal exercise is not strongly recommended. The main reasons are that firstly, many patients will have a problem or pain that's impeding them. 2, energy levels often drop in the early phase of adaptation, which can compromise performance. And 3, the focus needs to be on learning the diet and the individual response to the diet for them. Now, this doesn't mean you should do no exercise. By all means, avoid being inactive, but don't expect to feel as energetic when exercising in the first few weeks of starting a low carbohydrate approach. Once you're burning fat, preferentially as indicated by your ketones and appetite, exercise can help promote better insulin sensitivity. The slightly higher protein intake can help support more muscle growth, and therefore it's important for us to measure other indices of body composition, not just weight. You can lose fat and gain muscle at the same time, and all of this results in improved glucose disposal and insulin sensitivity. At further visits, you'll be given your blood test results, further resources and recipes, individualised advice, and referral for follow-up with an exercise physiologist or physiotherapist who can give you a personalised resistance training program to accelerate your results. The goals of this program are to give you the best value for effort with straightforward, achievable exercises. So you can see here a few basic exercises that I've included. Wall squats, push-up holds, calf raises and bridging are bodyweight exercises that work fantastically well in most patients to get them off to a start, even before seeing another health professional for individualised, supervised exercise. Electrolytes, energy and recovery are critical. Keto adaptation is a term that describes a lot of physiological processes that happen acutely and over time with restriction of carbohydrates. The most common issue that occurs is low stores of salt, both sodium and sometimes magnesium, as a sudden drop in insulin levels increases the excretion from the kidneys. The symptoms of low sodium include headache, lightheadedness and fatigue due to the effect on maintenance of blood pressure, and low magnesium often causes muscle cramps. Patients on blood pressure medication often need regular medication reviews to ensure they're not over-medicated. Deliberate supplementation of salt with about 5 grams daily added to food, as well as magnesium, is a good way to prevent this problem. It's a complex process, but in summary, the body needs to learn to use fat efficiently for fuel by upregulating the processes that subserve this. Now, different intensities of exercise from rest to maximal exertion gradually improve as we utilize fat for fuel, and we increase our metabolic flexibility, that we're able to use fat at higher intensities of exercise. The problem is that before the body's adapted to the use of ketones and fat for fuel, there's often a noticeable reduction in energy, particularly at those who are exercising intensely already. The main limitation tends to be to athletes who are considering using the ketogenic diet when they're at the peak of their training or performance. It can take many months for an athlete to upregulate fat oxidation and also to feel as energetic on a low carb diet. Power athletes are much more likely to struggle when compared to endurance athletes because at the highest intensities of muscle fiber contraction, glucose is always the preferred fuel. So having fat adaptation may not be a ready advantage. In patients who are not athletes, the main barrier to exercise occurs in the first 2 to 4 weeks due to the depletion of big chains of glucose called glycogen stored in the muscle and liver. Now, there's only about 400 grams of this, but when you're not eating carbohydrates and exercising, it will deplete after just a few days. And we know that each gram of glycogen can store up to 2 to 3 grams of water weight with it. So when we talk about losing water weight in the first few weeks on low carbohydrate, it really means water and glycogen. And these can easily add up to a couple of kilograms. So your liver can still make carbohydrates from other sources. It's a slower process and it's called gluconeogenesis, but your capacity to produce energy from a pre-packaged, readily available source becomes limited until your body learns to upregulate fat burning for energy. Now, most people performing regular recreational or aerobic exercise won't notice too much of a difference. So generally, we recommend backing off just the highest intensities of exercise for at least a few weeks when starting a low carbohydrate approach. Aerobic exercise. The way I look at this is that diet opens the gates and exercise helps energy move through the gates. There are so many health benefits of exercise, from improving cancer risk to heart disease to depression, but it's all about sustainability, and for those of us who really don't like exercise, it's about avoiding the harms of inactivity. If you have pre-existing heart disease or metabolic disease and you're not already exercising regularly, you should consult with a physician before becoming much more physically active. Otherwise, if you don't have heart or metabolic disease, there's very little risk and should be minimal barriers to increasing exercise gradually, even if you're new to regular exercise. Aerobic exercise is any exercise where you move your muscles and fuel is used for energy in the presence of oxygen. This includes walking, running, cycling, yoga, swimming, aerobics, and even low-intensity strength training with higher repetitions. There are different zones of exercise in which your heart rate will correlate very well to your level of perceived effort, or what we refer to as perceived exertion. And there are different risks and benefits of working at these different intensities. This is called the Borg scale, and it's one of the first ways that we found we could measure and quantify the amount of exertion that a patient was giving us, and therefore the metabolic effects of that exercise. The middle ground on this scale, you can see, is somewhat hard, and that's what we would call moderate intensity exercise at around that 12 to 14 mark. And this is generally where people feel that they can't speak in any more than sentences. So that's a good way of knowing whether you're in the middle intensity. Below that, you're doing lighter exercise, and above that, you're doing heavy exercise. Now, our level of fitness is largely determined by our body's ability and efficiency of using fuel for energy. Interestingly, when people think about fitness, they think that it has more to do with the size of your heart and your lungs in shifting blood and oxygen around your body, but it actually has a lot more to do with the efficiency of the enzymes inside all your muscles at using energy. And the basic unit inside every cell and muscle cell in your body that does this is called the mitochondria. And our mitochondria can be trained. So this is what happens in the early stages as we become fitter. It certainly happens much faster than the size of increases in size of the heart and lungs. And that is really the key to improving metabolic flexibility through exercise. Basically, we can think of the body as a kind of hybrid vehicle that can use both fat and glucose as its primary fuels. During all states of exertion, from rest to light exercise to all-out intense efforts, we use a larger amount, but also a different proportion of those fuels. At lower intensities of exercise and at rest, we've got low levels of burning both, but slightly higher proportion of burning fat. However, in insulin resistance and diabetes, the proportion of fat burnt during low intensity exercise and at rest is very limited. Now, if you imagine that your body is one of these hybrid vehicles, the highest proportion of energy that comes from fat burning occurs at a level of exertion just before you start moving quickly and recruiting fast twitch muscle fibers. And this is really described well as the feeling when you're walking or running or cycling, where it feels like you could go for a really long time, that you've reached a homeostasis between exertion and recovery, and generally where you can still speak in sentences. And this is a point that physiologists call fat max. See, physiologists often refer to this as zone 2, where generally we see there are 5 zones of exercise intensity. It's a lot like being in second gear if you imagine in your hybrid vehicle and you're keeping the revs high, but you're not flicking over into third gear or zone 3 and zone 4.
And this is where more fast twitch fibers start working and you start to need to burn more glucose, as you can see here. And zone 5 is all out anaerobic effort, and that requires the almost exclusive use of glucose. Through this journey, as you lower your insulin levels through a combination of low insulin eating, sleeping, mental health strategies, and exercise, you become more efficient at using fat for energy. And working in zone 2 in particular can help you achieve the highest levels of fat burning with lower peak joint forces. So exercise doesn't have to be painful, it doesn't have to be excruciating, it shouldn't be causing more pain, and really there shouldn't be great limitations to this kind of exercise with a low carbohydrate, low insulin approach from an energetic point of view.
Now, as your fast twitch fibers start to kick in with faster and more intense exercise, there's a shift from fat burning to glucose burning. The energy system used to power high intensity anaerobic exercise uses very little oxygen and fat. Examples include HIIT training, Tabata, cycling, HIIT and hill sprints. There are multiple benefits to this mode of exercise in a matter of minutes in terms of muscle growth, glucose disposal, and a raised metabolic rate for hours afterwards, which we need to acknowledge. But the higher peak forces can increase the injury risk and needs to be kept in mind. Resistance exercise is any form of muscle work that results in muscle fatigue. Lifting a load until fatigue is the key to calling it resistance exercise. Adaptations occur in the nerves initially that supply the muscle, and then after several weeks, muscle growth is induced. Larger muscle results in improved insulin sensitivity and a larger reservoir of glucose disposal so that insulin levels can be kept lower. No one ever said that they wished they had less muscle as they aged, because muscle results in improved balance, bone strength, and overall function. Resistance training can be done at a variety of intensities, generally referred to as the number of repetitions until fatigue. Now, most clinicians recommend 3 sets of exercise that involve large muscle groups such as squats, bench press, deadlifts, at a load that can be lifted no more than about 10 or 15 times before fatigue. Depending on how much rest is provided between sets, resistance training can have an overlap with aerobic training. And my favourite here, neuromuscular stability. It's often thought as the foundation of physical function. It relates to how joints and muscles work to control movement, and it can be thought of as core training, where we remember to recruit the smaller, finely tuned muscles that centre our joints. Pilates-style trunk endurance and spinal control exercises, as well as shoulder and hip rotator cuff, VMO knee exercises, and even intrinsic foot exercises can be considered as part of this type of exercise. In fact, most rehab exercises prescribed are about joint control rather than absolute strength. A few of my favourite neuromuscular stability exercises include a plank, wall sit, arabesque, and these all challenge the important stabilizer muscles, and I encourage all my patients to utilize this as part of their warm-up, depending on their specific issues and vulnerabilities. So here are some general principles of starting exercise. Firstly, remember it's best to focus on getting the dietary patterns right first before adding an extra variable, and certainly whilst backing off in the most intense forms of exercise when you are keto adapting. Avoid being inactive and sitting for long periods, and consider starting by increasing your step count or your incidental exercise, such as walking further, parking a little bit further from work, or taking the stairs where you can. Ensure you've gradually upgraded activity rather than suddenly, and make sure there's recovery days in there to avoid overuse injuries before your muscles, bones, and tendons have had time to adapt. Walking is the easiest option for many, and it gets you fresh air and hopefully some morning and afternoon sun. Cycling is a terrific option for Zone 2 aerobic exercise, and it can allow you to switch off, listen to a podcast,
and capitalise on increased fat oxidation.
Bodyweight strength exercises is often a combination of neuromuscular stability exercise, and this is a great point for many patients without the requirement of formal equipment or a gym. If you're going to increase the intensity and frequency of your training, or you're unfamiliar with the major lifts and movements in the gym, you really should consult a health professional such as an exercise physiologist or a physiotherapist with an interest in this for tailored advice, supervision and feedback.
So to summarise the role of exercise in a low insulin lifestyle, when we improve our fitness, strength and size of our muscles, we improve our insulin sensitivity, glucose disposal and fat oxidation altogether, which means you restore metabolic flexibility. If you haven't seen my previous video on how to harness a low insulin lifestyle that outlines the physiology and uses for exercise independently allowing for glucose disposal without the need for increased insulin, I suggest you go and check it out.
Exercise is also an opportunity to have some exposure to nature, the elements, and importantly, sunlight, which we now understand has some metabolic health benefits. Now, while dermatologists rightly point out the harms of sunlight for skin aging and cancer risk, there are some major health benefits that need to be weighed up for sunlight. Now, obviously, we all know about vitamin D synthesis with sunlight exposure. Thanks to Dr. Richard Weller and his research, we now also know that there are cardiovascular benefits to sunlight independent of vitamin D, and these are thought to relate to nitric oxide release. Nitric oxide is a potent dilator of our blood vessels, and sunlight exposure increases it. The issue is balancing sunlight exposure with harmful UV exposure. The balance seems to be to ensure that exposure occurs outside the middle of the day, so the predominant spectrum is UVA, which is well tolerated. In the morning and afternoon sun, generally when your shadow is longer than you, exposing your skin other than your face and scalp, which is known to be more sensitive, will maximise the benefits with minimal harm. Unfortunately, most sunscreens will block out the effect, and it's most likely that the benefits outweigh the risks of short exposure periods to lower intensity UV. So that's my guide on exercise for metabolic health. I hope you found this useful and enjoyed the content. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.